This morning we started the show talking about the Eric Williams Medical Sciences Complex, the North Central Regional Health Authority, some of the things that they are doing to improve healthcare for members of the public. I want to continue in the vein of health, and we are going to talk about being vaccinated for measles, because the Ministry of Health did issue a statement saying that persons should go and get vaccinated because the Pan American Health Organization and the World Health Organization report of an increased number of cases of measles in the Americas, which includes North, South, and Central America, and in the Caribbean region. I have with me Ms. Grace Sukhchand, who is the Manager, Expanded Program on Immunization. Good morning and welcome.
Good morning. Thank you.
How are you this morning?
I'm fine, thank you.
I want to start by asking you to tell us what measles is, in case people don't know.
Right, so for everyone, measles is an acute viral illness that is characterized by fever, rash, and a cough. It can develop into complications. Some of the complications can be diarrhea, otitis media, or as we currently say, earache for children, bronchitis, pneumonia, and in some cases, it can lead to death.
It can?
Yes.
So people really need to take some caution.
Exactly, and we find that our children, it's more contagious in children, so our children are at risk. Therefore, we should ensure that they are immunized against the vaccine.
At what age, though, should people get immunized?
Right, so we start the immunization program with measles at 1 year of age, and recently, what Ministry of Health has done as part of the initiative to ensure that we do not get cases of measles in this country is that we have reduced the age for the second dose of vaccines from 4 to 5 years to now 2 years of age.
To 2 years, so that's pretty young.
Yes.
And how do people get immunized? Where do they go?
You can go at any health center throughout Trinidad and Tobago. The service is free. It's available. The Ministry of Health has an excellent immunization program with respect to vaccine-preventable diseases. So anyone can walk into a health center, speak to the nurses there, and have their vaccines.
And you need to walk with the immunization card?
You can walk with immunization card. If you do not have an immunization card, we can issue an immunization card for you. But what we do ask is that parents keep their card, so that way it's easy to look at the history of both children and adults and see where we need in terms of getting booster doses of vaccines.
In terms of getting the vaccine, yes, you get it now. It's down to 2 years, so you can get it at 2. But how long does this vaccine last?
Right. So once you've had 2 doses of MMR vaccine, you're covered. When we give a child a first dose at 1 year of age, that child has 95% coverage.
95.
Once the child gets 2 doses, you have 100% coverage. So basically, we have run campaigns years gone by for vaccines. So our coverage, our immunization coverage in this country is excellent with respect to vaccine-preventable diseases. So once you've had 2 doses, you are covered, 100% coverage. If later on we do decide to give a booster doses, it's just a booster dose, but basically you are covered with 2 doses of the vaccine.
For people who may want to get the vaccine and they aren't sure if they got it when they were younger because they don't have their immunization cards, would there be any risks involved with that?
No. Once 10 years have passed, basically, it's okay, you can get a booster dose. And the reason why we are asking parents to secure those immunization cards, it is a requirement to enter primary school. But it's not just for primary school. Students need that up to university. So depending on what area you're going to study, in university, you need your immunization card. If you're traveling, you need your immunization card. But again, if for some reason it has been misplaced, as early as possible, you go back to the health center and they usually have records. If they don't have your record, let's say you're probably 40, 50 and we don't have your record, that's okay. It is safe to give you a revac, a booster dose, and to issue an immunization card.
What about children who may have special cases, probably children who get seizures and probably some other thing?
Right. All our children get the vaccines. We have doctors at the health center. If there are any concerns, the the patients see the doctors, and then we give the vaccine. But we also have, in case of an emergency, we have personnel in place, we have medication in place to treat with that. We have not really have any adverse reaction to persons getting measles. If a child comes into the health center and let's say the child has a high temperature, we will let the child see the doctor, get treated, and give a new date for that child to come in and have the vaccines.
How does one get measles?
It's highly contagious. It's more prevalent in children. So therefore, a child that is unimmunized is at risk in getting in contact with an adult or anybody who has the virus.
Mm-hmm.
So touching, coughing, just being around somebody who has the measles puts you at risk.
But should we be concerned in Trinidad and Tobago?
We have an excellent immunization program, I must say. The Ministry of Health has worked assiduously in ensuring that our people in this country are immunized. Our percentile are in the 90s. We should actually have 95% coverage. We are working assiduously to maintain that coverage. I can't say that we would have a problem. What we are doing, we are looking at all our children. At all the health centers, we get your births, we get the births. So we go out and we look for those children. We encourage persons to get the vaccines. Once we continue along that trend, we will not have a problem.
But we do remain at risk.
Because, as you rightfully said, when you started the program, PAHO and WHO has issued concerns with respect to cases in North, South, and Central America and in parts of the Caribbean.
Mm-hmm.
So we need to remain vigilant. We have a lot of migrants. We have a lot of travel back and forth. We are a global village. So therefore, we need to remain vigilant.
So the present strategy employed by the ministry to protect against the reintroduction of measles, what are the two components? I know there are two components.
With respect to
the strategies employed by the ministry to protect against the reintroduction of measles centers, and
Right.
there are about two primary components. One is the achieving and maintaining high immunization
coverage
and the other the prompt management of any cases.
of any cases. So therefore, once we have seen a case, we investigate, we try to ensure that there is no spread of that disease, we deal with it. But prevention is always better than cure. It's always better to ensure that we don't get the disease in the country rather than wait until we have a case. And that's why we are promoting immunization. That's why we are encouraging persons to go out there. That's why we have nurses at the community level going at homes, visiting persons who are not even coming to the health centers to ensure that they have the vaccines.
But what if a person actually gets measles?
So if a person gets measles, we ask if you suspect your child has measles, you visit your nearest health center as soon as possible so that that child can be assessed, seen by a doctor. We administer treatment, we advise the family members with respect to ensuring that the disease condition doesn't spread. We wait on confirmation, but we also start treatment.
What would happen if somebody actually contracts measles and they are to go to the nearest health center
facility, whether it's the hospital or the health center? You're going immediately, notified first person you see, whether it's a nurse or a doctor and clerical. My child is not well. This is what is happening, and they will attend immediately.
Yeah. And these vaccines, do they have any side effects at all?
All right. All vaccines, like medications, you get a slight side effect. Some persons might complain about a little bit of swelling, pain at the injection site. Some persons complain of mild fever. Remember, measles is a live vaccine, it's just like yellow fever and polio. It's a live vaccine. So some persons get a little reaction, but that's normal.
Yeah. But the main thing is that the country should not panic.
That is correct. As I said, let us stress again, the Ministry of Health has an excellent immunization program in place. There is absolutely no need to panic. As soon as you have your child at 1 year of age, you take your child into the health center. If you're concerned, if you have lost your appointment card, that is okay. You can visit the health center. The nurses there would give you a new appointment or administer the vaccines if it's required. There is absolutely no reason for us to panic, but we need to ensure that we continue getting our immunization, bringing our children in for immunization according to the schedule.
And if 10 years have passed since you last got immunized for measles and you're not sure or you can't find immunization card to make sure that you had the full dose, you can still go to the
You can still go and talk to the health personnel, still talk to the nurses and doctors at the health center, and they can advise you.
Because as you said, there are a lot of complications that you can get if you contract measles, which is highly contagious.
Right, and our at-risk group, let me stress, is our children.
Yeah, at-risk is true.
I have emphasized that we have an excellent immunization program, so it's hardly likely that there's an adult walking around without measles vaccines.
Right.
It's very highly, because we've been running campaigns ever so often. Every year we would have a supplementary immunization program where we vaccinate the public. We said, okay, come on, we're giving vaccines. Recently in April, we had Vaccination Week of the Americas, and we go around giving vaccines.
I remember when I was in primary school, if I'm not mistaken, it was the Couva Health Center, the officials, they would come into the primary school and
correct.
They would vaccinate the students. They would have an immunization card at the school.
That's correct.
Are programs like that still taking place?
It is still taking place. It's our school-based immunization program, and it is still taking place. Nurses do go out. For instance, the new term is starting in September, the new year is starting in September. So around October, so nurses will visit the school, liaise with the principals of the schools, ask the teachers to issue notes asking parents to let their child come in with their immunization card. They do a thorough head-to-toe assessment on the child, but they also check the immunization status. If your child is not fully immunized, we take the opportunity to immunize your child or give an appointment for the child to come in at the health center.
Yeah, and I was reading the statement from the Ministry of Health, and the ministry is reminding that all children between the ages of 5 and 16 years must be immunized before being admitted into a school. So that is important.
That is important. That is also the law.
It is the law.
It is the law. So when you take a child, when principals accept children without their full vaccination, that is against the law, and you also put other persons at risk. So it's easier to tell the parent, listen, according to this immunization card, your child is not fully immunized. I suggest you go to the nearest health center, get your child fully immunized, and we will accept the child.
And parents are advised to ensure that their child receives all the necessary vaccinations within the prescribed periods as well.
That's correct.
The prescribed periods.
All vaccines, we give a schedule. There's a schedule. There's a national immunization schedule that we work with. So it guides parents, it guides the health staff as to how vaccines are administered.
And this service is available at no cost.
At no cost. It's absolutely free.
And people can go to any public health center.
You can go to any public health center.
And the ministry said it remains committed and ready to the protection of the health of the public. And we had Mr. Davlin Thomason there on a short while ago, and they said that they are walking the talk and that they are going into communities and meeting with people and carrying out some tests to assist as well.
Which is excellent, and this is exactly what our community nurses do. We go out, we go into schools, we go into homes, and we ensure that the population that falls under our particular district are fully immunized.
All right, Ms. Grace Sukhchand, Manager, Expanded Program on Immunization. Thank you very much for coming in and chatting with us about the importance of being vaccinated for measles. As you clearly said, do not panic. About 95% of the population should have been vaccinated. The at-risk group would be the children, and
that's correct.
Parents need to ensure that they are vaccinated. They can take them to the nearest health center for their shots, and it is free at no cost.
That is correct. So parents, please check your immunization, your child's immunization card. If you're not sure, take them to the nearest health center so we can ensure that they're fully immunized.
And of course, the Ministry of Health is reminding that all children between the ages of 5 and 16 must be immunized before being admitted into a school.